elbows. So it doesn't necessarily affect only the knee, as we've been told and heard more about.
Yeah, so the reason people again think that it's just the knees, because when we think about arthritis in the general public, we're thinking only of osteoarthritis. And it's true that most osteoarthritis will affect the knee joint. Yeah, but it's not the case.
All right. I've heard about the bigger you are, the more predisposed you are to arthritis. How true is that? It's
actually true, because as osteoarthritis again is what we're referring to in this case.
Okay.
Because as I said earlier, osteoarthritis is affecting the weight-bearing joints.
The knee area.
The knee, the hip, the lower back. So if someone is obese or overweight, then it means you're placing more weight on those joints. And therefore you find someone who's obese may actually develop osteoarthritis that is, at an earlier age than expected for anyone of normal weight. Yeah.
And now that we have talked about and unpacked that area about the bigger you are, the more predisposed you are to arthritis, talk to us about some of the myths and misconceptions that surround this topic of arthritis. Some would refer to it as, say, witchcraft. We started by saying it's dismissed, as a normal part of aging.
Yeah.
So what are some of the myths and misconceptions that we, as the general public, have normalized that are actually not true?
Okay, so I'll begin with the most common one, thinking that arthritis is only osteoarthritis. But then, as we found out, there are other types of arthritis. Another common misconception is that there is the only way to relieve yourself of the osteoarthritis or arthritic pains is just painkillers. So, for example, you may find, so we have other therapies that we may do except giving painkillers. Of course, we'll give you painkillers to relieve the pain, increase the function, but then we also have things like physiotherapy. But then you find that patients are resistant to doing physiotherapy because they underestimate the role that it could have in
healing,
treating. Yeah, let's say treating, because
and we'll get more into treating as we continue this conversation. So you've said this is not only an older people, disease. How does it present itself differently in children? And what are the early signs that parents should look out for? If you're talking about at an older age, 50-year-olds plus are more, clinically showing signs of arthritis. But how about these kids?
Okay, again, it's not common in children, but we do have forms that occur in children, what you call juvenile arthritis. And we actually call it juvenile idiopathic arthritis. Idiopathic meaning that we don't exactly know we can't attribute it to anything exactly that would be causing the arthritis. You find sometimes it's genetic factors that predispose a child to getting it. But even with the presentation, you have it's the same thing all over. Pain in the joints. So the child will be complaining of joint pain. You may find them having some swelling. They may complain of reduced movement or discomfort, for example, when doing the same activities as other children. So now what happens with the juvenile arthritis or childhood arthritis is that people are not accepting of that, or even parents may be skeptical of that diagnosis. How is it that my child has arthritis? But that's again due to the misconception that arthritis is only osteoarthritis, which is common in the elderly. So again, if a child is complaining severally of joint pain or swelling or discomfort, then better to just take them to a pediatrician who will give a proper diagnosis. Yeah.
Are there, these types that we've mentioned, are there any that would say that maybe is hereditary? Because we've heard of, if we talk about lupus, we've heard of sometimes lupus being hereditary and being in the family line.
Yeah.
Is that with every type of arthritis, or lifestyle disease? Is it a lifestyle disease or a hereditary disease?
I'll say again, osteoarthritis is neither hereditary nor lifestyle, although being obese does increase the likelihood of getting it, and even getting it at a younger age. There's some genetic factors, but osteoarthritis is basically that with time the joints are wearing out. The cartilage is being destroyed just because of aging, sort of the way the skin will age in any person. Yeah. And therefore you develop osteoarthritis with age. Then when it comes to gout, it's more of a lifestyle factor actually. So you find it's common in men because of the kind of diets they may have. So red meat plays a big role, excessive red meat, and alcohol. So that causes a lot of joint inflammation and accumulation of the uric acid salt that I was describing earlier. So in someone who has gout, then that is a predisposing factor, the alcohol, the excessive red meat. For rheumatoid arthritis, it's mainly a genetic disease. So you may find that one of the relatives had rheumatoid arthritis as well. But then it's not purely hereditary. You still may find someone who didn't have relatives who had it. And on top of it, smoking also just predisposes one to developing rheumatoid arthritis.
Have there been cases for you, of course, as practitioners and doctors, where you've had cases where arthritis has been misdiagnosed before and has been confused for something else? Because we've had of other conditions that people go to the hospitals and they're told, oh, you're suffering from this. They go to another practitioner and they're told, no, it's this. And the third one maybe just gives a third eye and says, you could be having arthritis. So has there been any cases of misdiagnosis, and how prevalent are these cases of misdiagnosis, if there are?
Okay, when it comes to osteoarthritis, because again, the public is quite informed about osteoarthritis. They expect it to be in the elderly. They expect that it's the knee which will be affected. For us, the test that we begin with, which is X-rays, which are relatively cheap, give an accurate diagnosis. So you find that osteoarthritis may not be as misdiagnosed as, for example, rheumatoid arthritis. So with rheumatoid arthritis, there's a challenge of a diagnosis because you find that it involves some genetic tests which may not be readily available for all, or even affordable for many people. So I think the time it takes to diagnose rheumatoid arthritis may be a bit longer than osteoarthritis. So one may dismiss someone as simply generally arthritis, and yet it's rheumatoid arthritis, which means that even the treatment may be affected and proper treatment may be delayed. Even for gout, you may find that there may be a challenge, but most commonly, I'd say in my experience, you don't find arthritis being misdiagnosed.
It's just easy go. We've talked about the causes. You've talked about